Okay, up next we have Dennis Davis. He is the Vice President for Laboratory Sciences at DHR Health. He is a certified medical laboratory scientist with 28 years of experience. Under Mr. Davis's leadership, the Laboratory Sciences Department at DHR Health has expanded 3 times, including the addition of in-source clinical microbiology and pathology testing for surgical pathology samples in 2008, and core laboratory automation for clinical chemistry in 2009. Mr. Davis earned his Bachelor of Science in Medical Technology from the University of Texas Medical Branch in Galveston, and also a Master of Business Administration from Our Lady of the Lake University. Please welcome Dennis Davis.
Thank you guys for having me to come up to speak with you about laboratory medicine. It is a passion of mine, laboratory medicine, and so I hope I don't bore you guys because I'm a little bit of a nerd, and so I do love everything associated with clinical laboratory. And so oftentimes when I talk about clinical laboratory services, I'm going to get that ugly picture off the page there. So I always start with a case study so you guys can understand what I'm talking about. A few years ago, and it transitions also into the professions that I'm going to talk to you guys about as far as careers within laboratory medicine. A few years ago, a young lady came to a hospital in East Texas, Athens, Texas. And when she presented to this here phlebotomist, a little young guy, about 19 years old, she said, you know what, I just didn't feel well. And so my doctor told me to come to the hospital to get my blood work collected, and so that he can run some tests. And so this particular phlebotomist, and I'm going to talk about phlebotomy, I'm going to talk about the person running the test, I'm going to talk about the physician as well. This particular phlebotomist collected the blood, went over, gave it to the MLT student, and the MLT student at the time mixed the specimen, put the specimen on the Beckman-Coulter hematology instrument. It did a 3-port diff, and then had to make a manual slide. And so all these things I'm going to talk to you about when I get into the actual specifics associated with each one of the disciplines. And so it made a slide, and he looked at it under the microscope, and he's like, whoa. He's never seen these cells other in a textbook before. So when we're talking about slides and abnormal cells, the normal cells within the body, you're going to see your neutrophils, you're going to see your lymphocytes, you're going to see your basophils, eosinophils, you're going to see lymphocytes, and platelets and red blood cells. And so this little student said, I didn't recognize anything. So he went over to the medical laboratory scientist, which is a senior level position, and I'm going to talk to you about that as well, and said, hey, what is this? And she laughed and said, well, you should know because you were taught this. And then they went and looked at it under the dual microscope, and she said, who was this patient? These are all abnormal blast cells. And again, this person just walked in and said, I don't feel well. And so she called the pathologist over. The pathologist came over, looked at the slides with this particular student and the medical technologist, and the pathologist said, these are all abnormal premature cells. And we're going to have to send this out for flow cytometry on this patient. Who is the doctor? I need to call this person's doctor immediately. That person, not feeling well, walked in, routine lab work, just entered the life of cancer. That is laboratory medicine. That 19-year-old person was myself. I collected her blood as a phlebotomist. I went and ran the blood as an MLT student, and I looked at it under the microscope, and I said, whoa, I've never seen this before. And it really introduced me into laboratory medicine. It's something that a person, and she was dressed really nice lady in her late 30s, and it hits you in the face. That is laboratory medicine at its best. The people in the laboratory, as many people know, they're classified as the unsung heroes because they're behind the scenes. In the pandemic, what did you guys hear about? Testing. But what else did you hear about? Who was on the front lines? Nurses, doctors. Do you guys know who was running all of that test behind the scenes? Laboratory professionals. As I was introduced, I'm the Vice President of Laboratory Services at DHR. We were running 10,000 tests a month. We brought in an instrument from Roche that we had to bring in FDA, EUA, got it in, got it up, started doing testing. It was amazing the amount of work that the laboratory professionals were doing. And of course, getting those results out so they can treat those patients. We're still actively, it's going down now, thank God, it's going down now, but still we're actively running somewhere between 5,000 and 7,000 tests a month. And so it's one of the things that laboratory medicine at its best is what you have seen during this pandemic, because it's not just, you cannot flip the switch, turn on the instrument and start testing. You have to validate it. You got to make sure it's accurate. You got to make sure you're in compliance. And then from that particular point, then you got to go ahead and get procedures, everything's done, get it signed off, get it ready to go, and then you start reporting. One of the key things about any laboratory, their job is to provide high quality, cost-effective, and timely patient care results for their healthcare professionals, period. And so again, when I start talking about laboratory medicine, that nerd in me, I get so excited. So y'all have to excuse me there. So laboratory medicine itself, you're basically looking at everything when it comes to specimens within the body, and you're doing an examination associated with that. And so it's one of the things that I started out early on, and it's something that was very, I call it the investigation of science. And I always like to share a story also. The reason why I love another part that I'm going to talk about is microbiology, is of course bacteria. And you guys, some of you may get grossed out about, but I quit using the public water fountain back in 1989. There was a reason why I quit using public water fountains in 1989 was when I started my microbiology class, they said, go out and culture anything you want, bring it in. So you know what, I swapped the public water fountain. And I came back and started growing the bacteria, and they said, and I identified it, and it was Klebsiella. And I said, well, that's it for me in public water fountains there. So, so that is a little bit associated with that high level regarding laboratory medicine. And anytime you got any questions or questions, please feel free to stop me and ask me, because it's a wide variety of things that we do. And as you guys can see right there, again, blood work, body fluid, surgical specimens, microorganisms. These are things that we do on a daily basis within laboratory medicine. And so when we're talking about a technologist, of course, you have different levels, and I'll go into those levels as well when I start talking about that as well. But we prepare the specimens, we look at them on a microscope, we look for abnormal cells. You remember the case study that I started with, abnormal cells. And those are things that we look for. The normal things usually just auto-approve, we don't even see those, but it's the abnormal things that we're looking for so that we can help our clinicians with their diagnostic tools as far as when they're treating their patients. A pathologist. A lot of people don't realize within laboratory medicine, we have an MD called a pathologist. And as I indicated in that case study, as soon as I saw those abnormal cells, I talked to, her name was Jessie. She was the medical laboratory scientist. We grabbed the pathologist. He came over. He looked at it under a microscope. Pathologists, there is a wide variety of pathologists. It's just not a histopathologist that look at cells. We have cytopathologists. We have, of course, histopathologists, as well as you got blood bank pathologists. You got pathologists that specializes in microbiology and all the disciplines within laboratory medicine. And what they do is once you get a specimen, a surgical specimen from a patient, that specimen comes to the laboratory and we process that specimen. And so it's one of the things that I want you to think from that overarching theme of all specimens come to the lab. And we take a look at it for things that are abnormal. And so if you're familiar with cancer, those pathologists are the ones that are working with the surgeons. Those are the ones that are working with the primary care doctors. They're the ones that are working with the oncologists to diagnose those patients. And so when that specimen comes into the lab itself, we have to go through a series of processes, and we'll talk about all those particular individuals that touch that specimen. And so when they touch that specimen, they receive it in, we take an analysis, we call it a grossing of the specimen. What does it look like? Then we measure it, we weigh it, we cut it up, we put it in a tissue processor, we dehydrate it so that we can cut it and put it on a slide and stain it. And then once that particular specimen is stained, then it goes to the pathologist, the MD, for that person to take a look at it, to look for abnormal cells based upon the stain of that particular tissue. Then, of course, again, that nerd in me, then we reflect for IHC stains for special antibodies to fluorescence based upon their particular diagnosis. That is the world of laboratory medicine, because our key is making sure that we're able to provide diagnostic information for a healthcare provider to treat their patient. Once that particular patient that I referenced earlier, that she entered into the world of leukemia, you're talking bone marrows. You're talking that particular patient is going to come in, we're going to have a lot of biopsies for those pathologists to take a look at, for the MD to take a look at under the microscope, so that they can diagnose, is she getting better or is she getting worse? The next course of treatment for the oncologist. See, it all interconnects. And so that's one of the things that when we talk about laboratory medicine, the unsung heroes behind the curtain, those are the ones that are out there looking at those slides and making sure, is this abnormal, normal, not, report it out, call immediately. Yes, question?
So my husband had been having a lot of swelling and pain for years. And he kept saying it's gout, on his head. He diagnosed himself, kind of thing. He wouldn't go to the doctor. Finally went to the doctor. Oh, thank you. I went to the doctor just a year ago. And so they did all kind of blood work. They came back and they told him they were going to test him for it. So they were going to see. And then they called him back, all that is negative. We don't know what's wrong. So they didn't want anything. He said, what's wrong. So he changed his diet, started doing fasting. Also, he's not there. He lost weight. But he felt better. And then all of a sudden, he felt better for maybe 2 months, and then the pain came back again. The swelling in different areas. And so he went to another doctor. So that was in Arlington. He went to McAllen. So another did the blood work. They came back and told him the tests were different. So he went to an oncologist. They were going to test him for, pancreatic cancer. Everything came back. So then the third doctor decided, well, I'm just going to give you a small dosage for RA. And that did the trick.
Okay. And that's one of the things that...
They didn't diagnose.
Yeah, and that's one of the things that, again, as far as laboratory medicine is concerned, providing information. Because when you come in, and a lot of it is just what I talked about, an investigation. Because sometimes when a person presents, it's green light. Okay, like I told you about my case study. She came in, abnormal cells, boom. We know, leukemia, and then the course of treatment. Sometimes you present and everything is normal, but you still have a pain here. You got a pain there. Okay, all this is normal. Okay, let's move on to this here. Take a look at this. And continue to move on until they come up with the differential diagnosis so that they can actually provide a treatment plan for those particular patients. Because sometimes it's not that simple. And that's one of the things that's very complicated when it comes to medicine. It is actually an exercise in investigation so that they can come up with the best treatment plan. And that's one of the things I always love questions like that, because a lot of people say, well, I have all these tests, but it didn't tell them anything. Yes, it did. It told them that we know that this is not the issue. I need to keep working to find the issue. Okay. That's a good question. Okay, any other questions before I move on? Like I said earlier, that when we're talking about laboratory medicine and being able to provide those particular answers, about 70% of all diagnostic information that a physician or healthcare provider makes is based upon those laboratory tests. And like, for example, when you go into the ER, you have chest pain and you have pain irradiating down your left side. The first thing they're going to do is blood pressure, but they're going to run a troponin test. The reason why they run a troponin test is to confirm whether or not you're having an MI. And so if the troponin is not elevated, then they move on to something else. If the troponin is elevated, then they go ahead and look at some radiology studies to see if you need to go to the cath lab, get an angioplasty. So those are the things that they do, rule in or rule out. And a lot of their diagnostic information comes from the laboratory, so they can rule in a diagnosis or rule out a diagnosis. A pathologist, as I indicated earlier, a wide variety of information as far as anatomical. When we're talking about the specimens coming out of surgery, we're talking about forensics. Those individuals that are pathologists that are doing autopsies, they're also pathologists. And so whenever you got unfortunately, a person that passes away of unknown origins, their body comes to a pathologist, they do an autopsy of that particular patient, and again, they're doing laboratory tests as well to find out just exactly what happened to that particular patient as well. Any questions before I move on to the next category? Medical laboratory scientist. That is a bachelor's level individual when it comes to laboratory medicine. As I indicated in my previous case study, I was an MLT student working with medical laboratory scientists that were in a training program up in Northeast Texas. And so that is a person that basically is the bread and butter associated with laboratory medicine. There's many different disciplines within laboratory medicine. So we have blood bank. How many of you guys know about transfusion medicine? You see those blood donations and those things like that? Well, in the background, when you come in, we run a CBC in hematology. You got a low H&H, your hemoglobin hematocrit, and then the doctor says, you know what, we need to transfuse you. Well, they just don't go in and pick out a unit of blood. We have to do additional testing. And so it is that medical laboratory scientist that goes, okay, I take your blood, I get a unit of blood, and I have to cross-match it together to make sure they're compatible. The reason why we make sure it's compatible is because when they transfuse it into your body, we want to make sure that you don't have a reaction, that your body does not produce antibodies to go ahead and attack those cells, and then you have a huge reaction. And so that is, again, clinical laboratory scientist at its best. Microbiology, you got medical laboratory scientists that work in microbiology. So you have a cut, it gets infected, they swab that particular site, and then we put it on on a plate, we grow the bacteria, and then we look at what drugs that are sensitive or resistant, and then of course the pharmacist prescribe those drugs to fight off that infection. Because you guys hear about the pharmacist, but you need to know who's doing that work behind the scenes. Those are the medical laboratory scientists that are actually sitting there looking at those plates, identifying the bacteria that's circulating within your body so that you can get treated. Now, one of the big things that I always tell people, they like to say, well, I can just go and get antibiotics and that'll take care of everything. No, don't do that, because we got so much resistant bacteria because people are taking unprescribed antibiotics. So that's my little soapbox, so I'll get off of it now. And also, if you prescribe antibiotics, make sure you take it to the final pill as well, because you don't want that bacteria to mutate, stay within your body, and become resistant as well. All right. Clinical chemistry is another area within laboratory medicine, because all of your glucoses, your cancer markers, all those things our clinical chemists, they do as far as medical laboratory scientists is concerned. So got a lot of disciplines within our profession that are subsections of clinical laboratory medicines that bachelor's level individual can do. Because I remember early on when I started out, the person said, wow, you're going to play with poop and pee, and why would you do that? And I said, well, I'm doing it because it's exactly what I want to do. It's that investigation to find out just exactly what's going on. And so one of the things that I highlighted, it requires a bachelor's level degree for you to become a medical laboratory scientist. They do have a program here at the University of Texas, Rio Grande Valley. I think I got it right. I used to teach at the program over here too, that's why I want to make sure I got it right. It was Pan Am when I taught there. And so certification is through the American Society of Clinical Pathologists. It's usually a bachelor's degree, so you got a 2+2 program, meaning that you do 2 years to get your basics and 2 years in program. We are a clinical site that hosts 4 students that come around and do their clinical rotations like I did many years ago. And so the students spend about 6 months with us, and then once they finish and graduate, then they're eligible to sit for the exam, the certification exam.
So that person that's trying to get into the medical laboratory scientist position can't use this Bachelor of Science. Do they have a bachelor's in biology? Can they apply for it, or they have to go for a program for?
Well, you have to go for a program to go ahead, and you can challenge the exam, but it's very hard to do that because of all of the didactic requirements associated with it. And a lot of people that have bachelors of science, they do go into actually medical laboratory science because it's an easy transition, because it's usually just 18 months to 2 more years, depending on your level of education there. And so a lot of our current staff members, they have a bachelor's degree, and then they just jump into the program, and then 18 months, they're sitting for the exam.
And that's, I know when we took a tour one time at UT, well now TSC or something like that over there, they said that they kept getting a lot of students that already had bachelors in biology, and they weren't able to get a job just with the bachelor's in biology. They had to go more into a route that way in order to get a sustainable job that's in
Yes, and I do it. Yes, that is true. And that's one of the things that, and I do visit with a lot of students that have their bachelor's in biology. And they come and I give them a tour of the laboratory, and it's really similar. It's just an advanced level of what they've learned in that particular BS degree. And so it's a real easy transition. It just, again, about 18 to 24 more months, and then they're in the world of laboratory medicine. That's a very good question. Cytologist. Cytologist is another profession within laboratory medicine. Cytologists are those individuals that look at, again, slides as well, pap smears. So when you're talking about SurePath, MPrep, they're the ones that look at slides and look for abnormalities. It's a common theme you will hear me continuing to talk about, what is normal and what is abnormal. And out of all the professions, I love all of them, there is a huge demand for cytologists because there are very few programs within the United States, and a cytotech can only look at per day 100 slides. And the reason why that is because it's fatigue. They're in a microscope, they're looking at the slides all day, they're looking for abnormal cells, and so you definitely do not want them to miss a cancerous cell doing a pap smear, because they're the ones that are looking at those, and they work very closely with the pathologist. And so, but there are some little, I call them tricks to the trade. If you got image-guided pap smears, which we do, they can go up to 120. But then, if you get an abnormal slide, then that counts for 1.5 slides. So, it's kind of like the math gets kind of weird there. So we have the only cytologist in the valley south of San Antonio. We need another one. So, and when we started this service line for our OB doctors, they were used to 10-day turnaround time for getting their results back. 10-day turnaround time for someone getting a result back, that's not good for our community. And so we developed an outreach program. We hired a cytologist, brought that person in, 24-hour turnaround time for negatives. And trust me, our clients are very happy about that because, again, it's about their patients. High quality, cost-effective, timely patient care results. And so that's one of the things that we do focus on. And so we're very happy to have her, and so we want to make sure she stays down here. The degree program, again, associated with being a cytologist, is a bachelor's degree, and then sit for a certifying exam through the American Society of Clinical Pathologists. And again, the ASCP is, again, a lot of the accrediting agents for all these particular disciplines within the laboratory profession. The pathologists, they oversee a lot of the things, and so to make sure that there's a certain standard that you have to pass, and then once you pass, then you have to, of course, do continuing education to maintain your certification. Any questions or comments? Histotech. Remember I talked about the specimens that are coming out of surgery, and I said that we had to take those particular specimens and then process those specimens. Well, then those specimens are touched by the histotechs. They're the ones that get those particular specimens, and then they go ahead, and it's really a neat process, trust me. Once they come out of the tissue processor, then we basically dehydrate them, come out of the tissue processor, and then we put them in wax. And it's really weird, yeah, but it's so cool. We put them in wax, and then we freeze that wax, and then we cut a very thin layer, and then put it on the slide and stain it. Those are my histotechs. And so one of the things, there are programs as well as on-the-job trained. I think somebody asked, do you have to have a degree? We do have on-the-job trained histotechs, but they do have a program for histotechs as well. And so those are ones that work closely with our pathologists. They make the slides, get them ready for those doctors to look at under the microscope, and then make their differential diagnosis. And then once they look at it under the scope, they see something abnormal, then they send it back to the histotechs to cut again, and then we do what we call those special stains that I talked about. That have special antibody markers in it that will flag with certain cancer. And so that is the role of a histotech. And so trust me, they usually come in about 2 to 3 o'clock in the morning, get everything ready, get everything cut, get all those slides together so that the pathologist can come in and start taking a look at them so we can move on to the next step for those particular patients. And these are the education requirements. They have very few of these programs as well, but it is a bachelor's program. They don't have any in this area, and so majority of the histotechs, they are on-the-job trained. And so, but even though you're on-the-job trained, after so many years, you can challenge that exam under the approval of a pathologist. Okay. Phlebotomist. And that's what I talked about in the very beginning. And it's the day in the life associated with a specimen. Those are those individuals that collect blood. And it's one of the things that I didn't even know what phlebotomy was when I first got introduced to phlebotomy and said, oh, you got to collect blood. I'm like, what? I said, oh, man, this is crazy stuff you guys are talking about here. And so you talk about needles. I don't even know what a needle is, and bevel up, bevel down. And so my first collection was like that. Yeah, they called me shaky there. And so, but one of the things that during one of the training in that hospital in Athens, I went over to my mentor. I said, man, I hate collecting babies. This is like, oh, it's terrible. Oh, I can't hold their little feet. She said, and I said, whew, I'm so glad to be done. She said, oh, you hate collecting babies? Okay, you can do it for the next 2 weeks. I started love collecting babies, so that I didn't have to do that anymore. But it is that introduction level associated with laboratory medicine. When I collected that one patient and collected that blood work, came into the lab, and then, of course, saw those slides, looked at that CBC, that was the beginning. And so once all that blood is collected, brought to us, is the phlebotomist. They're the front line for us, getting specimens to us so that we can go ahead and process those particular specimens. And usually they do have training programs, some of them between about 12 weeks, and so that they can go ahead and you can get certified. We do have a lot of certified phlebotomists within our institution, and through ASCP is one of the certifying agencies, and usually they round and do about 100 sticks. And after that, we train them and we let them go. Patient-positive identification is very important in the collection process associated with laboratory medicine because you got to make sure you got the right patient and the right tests, the right tubes to get them to us. Mislabels are huge, meaning that if we mislabel a patient, that means those results go to the wrong patient. So we want to make sure that's very important. And so phlebotomists are key to all of the work that we do in laboratory medicine. Questions or comments? Yes.
Question. I'm a cancer patient and I've had to have so many blood draws. Why do some phlebotomists have, a more light touch versus those who, ow, that hurts?
Yes.
What is it in that person's whatever?
Yes, it's technique. It literally is technique. And it's one of the things that a lot of people go, oh, you got to be kidding me. Yeah, because, of course, one of the common misnomers that people make in phlebotomy, they go, well, I have to see the veins. You can't see these veins right here. So you have to go by touch. You got to go by feel. And so it's one of the things that's a lot of people, they get it, they understand it, and then some people, it's not as easy. Because my mom is also a cancer survivor, and so it's very interesting because I went to MD Anderson. I took her on one of her trips there, and so the phlebotomist, and of course my mom told me to shut up. But anyway, I was like, well, no, I don't think you know. You told me to shut. I said, I do this for a living. I know what I'm talking about here. She said, you don't work here, and I was like, okay, Yeah, I said, okay, yeah. I said, they've been doing this a long time. You haven't collected, when was the last time you collected blood? Maybe about 20 years, but that's okay. All right, okay. But the technique associated with it is very important. And so that's why I go, phlebotomists are key to what we do.
My doctor has a specific note on my records that only this particular one is acquainted with another one.
Yes.
And so she's like, only this person can collect from her. Because the other one, I just...
Yeah, and because again, and what she's describing, some people, they do have very thin veins. They got veins that roll. You'd be amazed, because you stick a needle in and the vein went that way. Yeah, so, and it does, an experienced phlebotomist, those are those individuals that, trust me, you love because they're light touch, very easy, and they're really quick at what they do. Good question, yes. It can be other also as well. Yeah, so this is just one of the certifying agencies, but no, we do accept other agencies as well. Thank you. Sure. Good question. Yes. Yes, we do. We have phlebotomy students that come in and rotate with us as well. And so once they go through certain programs that we work with throughout the Rio Grande Valley, their students come in, they work with our experienced phlebotomists, go around and collect patients. But it's not just, we don't just throw them in there. We teach them as well the clinical aspect of collecting those particular patients. And so, yes, we do. And then you do. As far as what? As far as phlebotomy or medical technology? Okay. Yes. Yeah, yes, as far as that's concerned, yes, it is. Our training is the same because most programs are accredited by NACLS, and so they're required for 6 months of clinical training. And that's when we accept those students from like UTRGV or Brownsville, from Texas Southmost College. Those are MLT students. We take those students in, and they spend about 6 months with us. And they go through all the disciplines within the laboratory, and then from that particular point, their clinical experience is completed, and then they sit for the certifying exam. Okay, you had a question.
My question is kind of, I know we can look on the radio, and a lot of our kids want to get out of high school and get a job. And I have a little wants to go to med school, but then to come out and do it for college. So I told her maybe like a phlebotomy as an intro step. What kind of, I don't know if you know what the pay is, but is this?
Oh, as far as like, when I was looking at the pay around a phlebotomy, you're talking about somewhere between $14 and $16 an hour to be a phlebotomist.
And then the secondary question to that is, it's kind of a weird thing because she's like, well, people are going to look down on me if I just go through all these different certifications. And I kind of told her that like,
No.
it kind of looks better if you work your way through the medical field too, because you get the skills. Because this is what we said about a 12-week program.
Yes, yes.
They need the high school diploma and she could get it. And I told her, but then you could go on to do this or this or this. So, in your perspective, and kind of everybody here, if kids are going through like the little steps and kind of stepping up the education as they go, is it actually looked at as a better thing for them in some cases?
Yes.
Because they do have the experience, and so premature when you would be applying to get into, nursing school or things like that.
Yes. Example, and again, it's not because I love to talk about myself, but it's one of the things I want to share with you educators. I started as phlebotomist. I went on to get an associate's degree as an MLT, medical laboratory technician, that I'm going to talk about in a little bit. I went on to get my MT, which is a medical technologist, which is a medical laboratory scientist now. Then I went on to graduate school to learn management aspect, and I'm talking to you guys in the Rio Grande Valley as a vice president of laboratory services. And so you work your way, you work your way through. And it's one of the things that I always, it's not looked down upon, because time is going to pass. Education is very key. You continue working your way up the mountain until you achieve your goal. It's not going to be easy. And it's one of the things I know you guys are sharing with your students that you're visiting with, but it's going to be rewarding. That's the key thing, rewarding at the end of the day. And so, yes, and so that's one of the things that I always like to share. Because when I started at a certain level, you continue focusing on moving towards that final goal.
Weird question. Do you know if, like, financial aid can they get financial aid for these type of programs?
This program, I'm sorry, I don't know the answer to that question on that one.
But
Okay.
is it, because I know that there's like some places like in Laredo, I know like they have like a couple little, like for-profit places that
Yes.
do it too.
I'm not sure, but I know like the MLT program, MLT program and the MLS program, you do qualify for financial aid. You complete the FAFSAs and things like that, but I'm not sure about the phlebotomy programs. Okay. A pathology assistant, which is a PA. Ooh, I think I went over a little bit there, guys. Let me hurry up. A PA. Now, you heard Frank previously talking about a PA. Well, we have PA within laboratory medicine as well. The pathology assistant. That is that particular person that when the surgical specimens come in, they're the ones that do the gross examination of those particular specimens before we put them in a tissue processor. And we do have certified programs. They do the entire, they had to look at it, they dictate it, and then they cut it up because they make sure they see an abnormal area, they cut it up, then we put it into the tissue processor so that we can get it ready for the pathologists themselves. There are still certified programs within the country for PA, and again, pathology assistant, not physician assistant. And so, bachelor's level as well as master's level. And again, you got a certification through the American Society of Clinical Pathologists. And that is pretty much the day in the life associated with laboratory medicine. And great questions. Do you guys have any additional questions? Yes, go ahead.
Okay, so I don't know if that was answered before, but like for instance, someone who's trying to apply for a medical lab technician position or whatever, is it better for them to have, who do you look at more? Is it the one who has the experience who's worked their way up, or someone who's just coming out of school that's applying for that same position? Which one
Okay, I'll give you two examples. You know, as again, referring back to myself, as a 19-year-old guy right out of high school and then went straight into the program, didn't even know what phlebotomy was, didn't even, I was getting introduced to all these things, and they accept both, meaning that a person that does not have any experience and a person that has like a bachelor's degree, so they accept both of them. And it just, again, it's about getting the right candidate that they think is going to be successful in the program and be great laboratory professionals within your community.
And that's toward the program, but what about now getting hired at, for instance,
Okay, so yeah, so then once you complete your certification, and it just depends on which hospital, because all hospitals throughout the valley, they accept students. And so, and then you may be in Mission, you may be in McAllen, of course you may be working with us, and so everybody accepts students. And so once the students graduate, they get their certification, and then of course they apply, and once they apply, and then we try to select the best person to come and join us. Okay, does that answer your question? Okay, any other questions? Thank you guys, and I really appreciate all the hard work that you're doing for the students in the valley. I'm sorry, I didn't know it was going over that long. Okay.